Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Good morning. This is David Parra, and this is AARP, Arizona Hispanic Connection. I am so happy today. Oh, am I happy today? And the reason why is because I have doctors and nurses in the room, and it's unbelievable. On the one hand, if something happens to me, but on the other hand, I just see faces that are radiant, and I just smell and see success all over the place. So it just fills my heart. One of the objectives of this show is to celebrate Latino accomplishments. And when I see you, I mean, I'm older than you, I think, than everyone. So I kind of speak from an older position, so to speak. And I just feel so happy to see you. Welcome, everyone. Again, this is AARP, Arizona Hispanic Connection, with another great show. The show's title is Education. Actually, I had health, but it's really education. Latinos in health professions. That's the name of the show. We have La Doctora Adriana Perez. You had joined over the phone. And by the way, I have to say that the dream of implementing the AARP Arizona Hispanic Connection, it was a long process, and La Doctora Adriana Perez was very, very instrumental. I kept going to her a lot for advice and input, and I want to thank you really from the bottom of my heart.
My pleasure, my honor. The dream came true. Here we are.
Yeah, and remember to get the mic, and don't forget it.
I'll stick close
Yeah,
to
so we
Marilyn.
have Dr. Adriana Perez, and we'll have more time for you to tell us a little bit more about what you're doing currently. Mm-hmm. And let me see, you are Marilyn Torres Sierra, right. And I'll give you just a second for each of you to introduce yourselves. El Doctor Martinez Hernandez. Thank you so much, Dr. Hernandez, for being with us again. This is your second time, right?
Yes, this is my second time,
yeah.
so excited to be here.
Right.
You know, it's an honor, so thank you for all you do, David. We really
Thank you so much. You're welcome. And then we have Erika Castillo. We were also going to have Gabriela, let's see, I have her here, Bernal, but she couldn't make it, so if she's listening, we're with you. We're with you and with your kids. Apparently,
hope the kids get better.
I know. Okay, let me go around the table, because what we want to do today is to talk about whether Latinos are in the health professions. Is that important? And what are we going to do if they're not, assuming they're not, and we'll find out, to continue to motivate and continue to bring in. I almost feel like every time I see you active in social media, Dr. Perez, I almost feel like you have a big burden on your shoulders to kind of, yeah. I don't know if I'm getting it wrong or right, but I almost feel like you have a big burden to continue to advocate for more Latinos. So why don't we go around the table and just introduce yourself just a little bit. Tell us what's in your mind and how do you feel about addressing this matter. Go ahead.
Okay, David, well, again, welcome, everybody. It's nice to be here, nice to be home.
If you can pull the mic very quickly,
okay.
Right in front of you.
So, Adriana Perez, I'm originally from Yuma. I became a nurse, got 20 years next year. First became a nurse. And I started with the associate degree, track, and moved here to get my bachelor's degree at Arizona State University.
So where were you at?
I was first in Yuma.
In Yuma, okay.
And went to Arizona Western College. So, grew up in the border town. Very proud of the fact, because I feel like we never, we never acknowledge the good things that come from small towns, especially border towns. So I'm very proud of that fact. Erika knows I'm always talking about that. I'm from Yuma. So, but I came here, and I'm also proud of the fact that I'm a Sun Devil. Dr. Hernandez, okay.
I love my Sun Devils too.
Okay, I'm very proud of that fact. That's part of my upbringing, because Arizona State is an outstanding school. It really is. And but now I'm at the University of Pennsylvania, where really my passion is to change the way we practice.
Now, can you you jumped the nurse practitioner?
I did.
aspect.
No, I did a nurse practitioner program at
Here
Arizona
at
State.
ASU?
Everything, yes. My
Okay.
undergraduate program was at Arizona State. My master's program, which was as a nurse practitioner, adult nurse practitioner, and I received my PhD there. And I did a 2-year postdoc in gerontology, taking care of older adults, and had just started a faculty position when I was recruited to the University of Pennsylvania, where I never thought I would go because it's cold there. You know, I thought there are no Mexican people in Pennsylvania. Lo and behold, I get there and there's a huge community of Latinos growing.
Great.
We're everywhere, basically taking over
All
the world.
right. So when are you coming back for good?
You know, I
Never
hope
know,
to,
huh?
we never know. Right now, I feel like I just settled in to Penn. It's an Ivy League school. It's one of the original Ivy League schools, and not very many Latino faculty, especially Mexican.
Now, you did tell me that once you reach the level of a PhD, you're almost forced to continue to move whatever that field leads you to, correct?
It does. You know, it's about the research questions that come up. And so far in the studies that I've done, you know, going into advocacy, going into testing community trials that look at how we improve the health of Latinos, especially. And my passion is older Latina women because I feel like women are central to the health of their family. And through women, especially abuelitas, you know, grandmothers, I think they serve as an inspiration for grandkids to stay healthy. And
We'll come back to you because I still feel that you kind of bear a big burden on your shoulders. I almost sense that, you know.
David.
Now, Marilyn Torres Sierra, a few words.
So I'm not from Arizona. I'm from New York originally.
Okay.
And I was the child of a teen mom. So statistically, right, I probably shouldn't have gone very far, right? Well, I finished a bachelor's degree initially, and I was in the art world. And then I moved to Arizona, fell in love with the desert because it rained. And that smell that just came through, I fell in love with the desert. And so I actually got pregnant with my son. And I had a high-risk pregnancy, and at the time I'd been in women's and children's empowerment work, and so I thought to myself, what is the most powerful way that you can help a woman and children than helping her through the most vulnerable and powerful time of her life, which is birthing, and so I decided I was going to be a nurse, and I, through my mother-in-law at the time. She came with an article about this program called the Bilingual Nurse Fellowship Program. And
Now, this is already in Arizona?
This is in Arizona.
Okay.
They are starting the 21st cohort. I was part of the second cohort, and this program was supported by Congressman Ed Pastor. So it's like homegrown program from
No
Arizona.
doubt we're going to have to elaborate a lot on that
Yes,
program
yes.
in probably the third, fourth segment today.
Right,
definitely.
right. So the program was designed to create more bilingual nurses to support the Latino community during a health crisis, or even during, you know, supporting healthy lifestyles and changes and things like that.
Where are your parents from?
My parents are from Puerto Rico,
Puerto Rico.
yeah.
Of course,
my
La
dad
Isla
was
del
born
Encanto.
in Vega Alta, and my mom was born in Brooklyn, so I'm what you call a New Yorican or African Latina,
Okay.
right? So, you know, my Boricuas like to make sure we keep the boundary,
course.
right? So, you know, it was just a very powerful experience, and one of the most beautiful things about our cohort is we were the second. We still see each other all the time, and every single one of them is in school to become a nurse practitioner.
Wow.
So it's not just, you know, the education and being on the floor, but, you know, the Latina nurses are taking it to the next level by getting, you know, their doctorates and all of that.
Great.
So it's beautiful, powerful work. And the light on someone's face when you walk in the door and you speak their language is like nothing you can describe. They feel safer. They are more forthcoming with their information. And it really creates a very powerful experience as, you know, to support them through whatever they're going through.
Thank you and welcome.
Thank you.
Dr. Martinez Hernandez, a few words.
Well, David, you and I have something in common. I was actually born in East Los Angeles too. I'm a Southern Cal native.
Well, I
was
grew up in East Los
Yeah,
Angeles.
so see, I moved into the valley
You know, I
from
just
there.
saw some videos from East LA, and that was amazing. You know, now that the Fiestas Patrias are going on, you know, Hispanic Heritage Month, and it just brought. Actually, it was either a Whittier Boulevard or Brooklyn. Remember Brooklyn?
Yes, I remember, and it was so from there. where I did my high school in West Covina. When I graduated in 1989, my journey started in the back of, I always love saying this, the back of my pickup truck. My son just did a presentation on me at school. He's 10 years old. He's a future politician. Noah, I love you. Noah Maya Hernandez. So my journey got to the U of A, and literally at that point, it's like God put it in my heart. He's like, you will be a doctor. And, you know, I've always been the person to strive for the highest mountain. I had like $5 to my name, and I went after my anthropology degree, minor in biology. I have a master's in public health, community health emphasis, and then I went after my medical degree, all back to back to back. I haven't stopped ever since. I'll be 47, and I feel like I'm just starting, guys, because it is an amazing journey. But what the end point for me, I love hearing what you guys are saying about women's health, children's health, bilingual education. It's amazing because we need all that. I've been in the front line of medicine since 2004, and right now, to me, I'm working on lifestyle medicine certification. I started in Harvard. The sky's the limits, guys, and I'm just beyond honored to be a part of this group. Adriana, Doctora Perez, thank you, because I'm here for you. I remember when we started with the dream, and it's all about it. And every time I come here, I get to meet amazing people. So excited to be here.
Do you also feel pressure about advocating and seeing more Latinos follow this path?
Yes, huge. Good. I mean, and that's why I love it. Every time I have the opportunity. It's, you know, my wife's also a Latina. She comes from Yuma, San Luis. So
we need to have her on the show.
Yes, she will. She knows. She's probably listening right now. And I tell her, I will watch the kids. You come here, and we're going to share her expertise. But we carry that together, and that's one of our passions as a family and as a couple.
Thank you, and welcome. And now we have Erika Castillo.
Hi, how are you?
Doing well, thank you.
Good. So I'm Erika Castillo, and I'm also from a border city, El Paso, Texas.
Yeah. Wow.
So representing.
Yeah.
But I'm a newer nurse. Nursing is my second career. I did clinical research for about 13 years, and then I transitioned into nursing. So I've been a nurse for about 3 years now. I also obtained my ADN through Phoenix College, the Bilingual Nursing Fellowship Program, and pursued my BSN through ASU. And I plan to pursue my master's and possibly my doctorate through U of A. So a little bit of everything. Yeah.
Wow, this is amazing. Yeah. Now, before when we were setting up, I asked you, why not a doctor? Why a nurse? Remember?
Yeah.
And then you mentioned about you liking to really, really make an impact on people's lives. So nurses tend to spend more time with patients, right?
So, I mean, we all impact patients in a different way, right? Whether it be education, doctor, nurses. I feel as a nurse, especially at the bedside, we're with the patient 24/7, literally 24/7. Right. So I feel we have the greatest impact, I guess, especially with the Latino community. I feel like they look up to us for education. And I'm also a part of NAHN, so the National Association of Hispanic Nurses. And we're also
going to talk about the what is it, in the chapter number 1 in terms of membership in the country, correct?
Yeah.
The National Association of Hispanic Nurses Phoenix Chapter. Good.
And we have 2 chapters in Arizona.
Right. The mic.
Oh, sorry.
Get the mic. So 2 chapters, one in Yuma and one
in Yuma, and one in Phoenix, the largest one in the country, but good representation for Arizona. Good.
Erika, I don't know if we interrupted you, but feel free if you want to add anything more. So motivated to continue your studies
Yeah, definitely. So I eventually want to teach as well. In nursing school, I tutored students, which really I didn't realize I had a passion for that or a drive for that. But in tutoring, other nursing students, I really loved it. And I felt that I empowered them, and made them motivated to learn. And so that's what drives me. So I really want. Yeah. So I'm currently at St. Joe's. I actually started in oncology, and now I'm in the medical ICU. I've been in the medical ICU for 2 years. Did oncology for a year. So I'm a newer nurse. Good.
Yeah. And as I'm hearing you, I just remember that I have a nephew in California who is a nurse.
He needs to be a member of NAHN.
I know. Yes. And not only that, but I have a niece at ASU, and I remember Rachel Willis.
We connected.
Yeah. So at least two of my family members are in the health professions, so that's really good. As we move into the second segment, we would like to talk about whether Latinos, what data shows, and probably this is in your field, Dr. Perez, whether Latinos are coming into these fields, and if not, why not? What are we going to do to encourage more? I mean, I know these are very tough careers in terms of time. It's a big commitment of time and money. I'm sure. I don't know if you reached the $100,000, Doctor.
Oh, yes.
Dr. Adriana.
Yeah.
I mean,
We'll talk about
yeah,
We'll talk
and
about that,
so we
yeah.
want to talk about the careers and whether Latinos are in the pay, the different careers there are in this, I would say, broad field, which is health. We could even say healthcare.
Right,
the healthcare field. We are taking our first break. You are listening to AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you for staying with us. Again, this is AARP Arizona Hispanic Connection, and the subject today is education, Latinos in health professions. So let's get started on this important subject of, are Latinos pursuing professions, health professions? Is there a shortage? Is there a need, Doctora Perez? How are we doing in this broad field?
Well, there is a shortage. Certainly, Latinos are entering the health profession, but the challenge is that it's not at the rate of the growth of the Latino population.
Okay.
So, for example, in the country, there are roughly 3.2 million registered nurses. And out of that 3.2 million, only about 5%, maybe a little bit less, are Latino nurses. So when you think about, we have roughly 30 million Latinos in this country. We have about 168,000 Latino nurses. That's not enough to keep up with the growth of Latinos. And I think it's the same for the medical professions and other health professions. Yes, we have them coming in. So we have the demand, but we don't have the supply meeting that demand.
A lot of times we hear that Filipino nurses come, nurses from other countries, maybe India. Is that the reason why? Because we don't have enough nurses here in our country?
Yes, and especially in some states, because of the population of that state, we don't have enough nurses to care for that number. So some states like Arizona have a shortage. There are states that not as much, but certainly throughout the country there is a shortage of nurses, and there will continue to be. There's some conflicting data out there that in the next several years we will have a surplus, that we will have plenty because we've seen a growth of nurses in the field. But it's still, again, when we look at where the deficits are, bilingual, bicultural Latino nurses, other multicultural nurses are needed. We don't have that. We're still a pretty, mostly female, mostly white profession.
Why is it that we don't seem to attract males to this field?
Some of the research shows that we've gone from about 5% male to 10%, almost 12% male.
So we are making some progress.
We are making. I mean, in Latinos, we're not making the progress because we're not keeping up with the growth of the Latino population. But for men, there's some data out there that says in some cultures especially, the nursing profession is seen as a female, especially, it's female dominated. So it's more of a profession for women. But I think we're changing that stereotype, and we're seeing some huge gains. The American Association of Men in Nursing is doing some great work to promote nursing as a male's profession as well.
Now, you, with having gone in the direction you went in with your doctorate, are you more you move more in the realm of nurses?
Yeah.
As opposed to, like, say, physicians?
Research as a PhD prepared nurse. Your focus is research. So that's the majority of my work is looking at practice, looking at developing knowledge, David. So bringing knowledge into the field that we need, because a lot of what we do, we hope that we're practicing based on evidence. Well, a lot of that evidence is missing for Latinos, and that's my goal, is to make an impact in what we have as far as evidence for how we care for Latino families.
Right. Dr. Hernandez, how about in the physician And now when you talk about physicians, that's like the basic one. Then you become a special, right? Like a specialty, maybe a surgeon, etc.
Yes.
In your field, how are Latinos doing? Are we also
Well, the numbers
coming in?
are pretty similar to nursing.
Yeah.
And if we just look at the data from 2010, 14.2% of the U.S. population is Latino. And I think you probably, is that number about the same now, Dr. Perez, or is it, I'm sure we're
It
getting
keeps
up
growing,
there.
yeah.
We're growing like yearly and
Right,
daily.
right.
But during that year, 6.4% of the Latinos graduating from U.S. medical schools, that's the total number, which is a good number. And I think that number, I'm sure today is probably 7 to 8%. But if you look at the numbers, 3,000 to the patients, Latino patients, just have one doctor available. And in non-Latino patients, the doctors have they have 335 patients to one. So shortage is. I'm going to focus on primary care because that's what I do.
Right.
And primary care, I believe, is where the need is greatest
Right.
in medicine.
Exactly.
And I like to see a paradigm shift in that we need to get more, and that includes OBGYN, pediatrics, internal medicine, and family medicine, what I do. So if we're starting to see the numbers change. Currently where I'm at, I have 2 amazing Latino physicians that work with me. And so it's an honor. So out of 11 physicians, 3 of us are Latino. So, and it's and what happens is they come to us. They come because we understand the culture. And so that's very important. So it's the numbers are, we got to keep working on them. So that's what we're
You know,
here to
now you
discuss.
said that you're working as a nurse currently?
I am.
And you too?
I'm actually faculty for Phoenix College
Okay.
now. So I left the bedside a couple years
But you
ago.
already did some...
Absolutely.
Okay. Can you share with us why is it important to have Latinos in these fields in terms of culture, language, etc.? I'm sure you saw it firsthand.
You know, in my experience, I feel that we understand familismo. You know, that's big within our community. Understanding that not only the patient, we don't just educate our patient, but we educate their family and, you know, their extended family. So I feel that's one of our biggest contributions to our community is just that understanding of.
So are you saying, if I'm
culture.
understanding you correctly, that the person that it needs the care and the family, it makes a big difference if the nurse who is helping them understands them in terms of the culture and the language?
Of course. I mean, just walking into a patient's room and, you know, again, the majority of our nurses speak primarily English. So when I walk into a Spanish-speaking room, patient's room, they automatically, you know, they glow. They're just so thankful and grateful that I can speak the language and relay information to them. I actually have nurses in my unit that come seek me out to go talk to their patients.
And that was
you
going to
know.
be another question that I have. So basically, sometimes they have to go and grab a nurse that speaks Spanish.
Yeah, you know, for the
example.
basic, just you know,
Right.
care. But we do have translators available for our patients in the event for consents or bigger procedure purposes.
Do you feel that a patient will be more prone to even review a few more items about the conditions if they trust the nurse as opposed to if they don't trust the nurse?
Oh, of course, 100%.
Which is
Yeah.
very critical, Dr. Hernandez, if they don't tell you all what's going on. I mean, as a doctor, I'm sure you kind of have to play psychologist and kind of read into what they say and don't say. I assume that you have to do
It's the same thing in medicine. It's like, it's interesting because a lot of times people look in the directory and they'll see Hernandez. So they're like, they're coming to me, and I thank God for my mom for making me bilingual.
Well, I'm telling you, I speak both languages, English and Spanish, and if I have to pick a doctor from the list of my insurance, I am attracted to a Latino name, and I can handle. I mean, I've had doctors from other countries as well, you know, not just Latinos,
Yes.
but again, there tends to be a little pull, if you will, a little attraction to a doctor that has, you know, a last name like yours, you know.
Yeah.
One of the other interesting things too is that we have data like at the hospital level. You know, I was with Banner Health for the majority of my career as a nurse, and the data shows that when patients do not trust their nurses and there's not that communication, that there are more risks to the patient as far as safety is concerned. Things like, their ability to take care of themselves when they get home, and not understanding the language or not feeling like the nurse understands who they are. And this extends beyond Latino culture too. This also extends to cultures that are very, family-centric, where, they want, like, say, a mom is going to deliver, and they want the tia and the abuela and the three madrinas and all of that, in the delivery room. And so, it becomes a cultural challenge at times for nurses, where they're concerned that, they're going to be interfered with. And it's a challenge for the physicians as well, because, we're in a high, like, I'm going to sue you because, I stubbed my toe in front of you culture, and so they feel like they're being watched, and they get very uncomfortable, and they don't understand that it's just a family event, and so we, help by, putting more Latina nurses on the floor. We help to make that bridge. And, the nurses and the community, the medical community is sensitive, and they know this is an issue. And so there are tons of training that's happening at lots of hospital facilities to help create more communication, to help, adjust visiting policies so that, families can have, the people they want with them as they're going through their life-changing experience.
And Dr. Perez, you are a nurse practitioner. Can you briefly explain the difference between just a registered nurse and a nurse practitioner? And what is your feeling about this aspect of nurse practitioner? Do we need more? Is the government going to make changes in this field to allow them to perhaps, operate as doctors too?
Well, nurse practitioners are definitely needed in the country. This is the only country that has, the nurse practitioner role. So if you go to another, they might not have this similar role. The difference is obviously in education, preparation. Nurse practitioners are educated and prepared to be able to diagnose and be able to treat. They're advanced practice nurses, but we still collaborate with physicians, and that's important. But our specialty is on the wellness aspect, the keeping people healthy. Certainly somebody coming in for their annual wellness visit can see a nurse practitioner, and more, actually, David, with the support of AARP through the Center to Champion Nursing in America, we are promoting that nurse practitioners practice to their scope of
I always
education and
like
training.
to sorry to interrupt. I always like to repeat things because it's very easy to. We're saying so many things.
Yeah.
Can you repeat that name again? And if there's a website, so just those that are listening in,
Absolutely.
that perhaps this is the first time they hear that. If you can give them the address so they can visit the page later on.
Yes. So the Center to Champion Nursing in America is housed at AARP. It's what promotes the campaign for the future of nursing in this country. The campaign is based on a landmark 2010 Institute of Medicine report called The Future of Nursing, Advancing Change, Advancing Health, that really focused on improving the health of the nation. And because the majority of healthcare workers are nurses, the Institute really focused on nursing front and center, promoting leadership, promoting, advanced practice, diversity. There are like three or four pillars that are part of the campaign's, initiative. So through that initiative, there's a lot of work going on at the state level to promote nurse practitioner practice because we're regulated by the state. So some states have limits on how nurse practitioners can practice that is not consistent with how we were educated and prepared. So we want all nurse practitioners so that patients can ultimately receive the care that
Where's
they need.
Where's the website? What is the site name?
If you look for campaign for the future of nursing, it'll come up. Yes,
Okay.
Center to
Campaign
Champion
for
Future of Nursing campaign. for
How
action.
big is this effort?
Well, there are 51 state action coalitions. So one coalition in every state.
Okay.
And together that makes up the campaign. So Arizona Action Coalition, we have one. And it's made up of all the nursing interest groups coming together to promote scope of practice, to promote diversity.
Is NAHN, the National Association, kind of part of that?
Yes, all of
Okay.
the associations are part of it. The Black Nurses Association, they all come together to implement those recommendations of the Institute of Medicine.
It's a big hub, you could say.
It is. It's a big hub.
Okay.
And it's, and it's housed at AARP because AARP is the largest a consumer advocate, not just here in the U.S., but in the world. So it's a partnership between the consumer and nurses.
Perfect. You are more than welcome to visit that website. We have to go on our second break. You are listening to AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection, and we have 4 very, very, very successful people. 2 doctors, and actually 1 nurse, and then you are a nurse, but then more than that, and you're pursuing more education. Amazing, amazing. Thank you. Let's focus on this third segment on, I believe that people want to know about the different careers that are in the healthcare professions. But more than that, what does it take? The time commitment, the money. I have heard hundreds of thousands of dollars in debt. Is there help? Where? How do I start? Can we kind of start that conversation? And I'm sure that you can provide a lot of information on this subject.
One of the things that I'm really proud to do is to be a graduate of the Bilingual Nurse Fellowship Program and then go back and be a faculty member now for community colleges. I believe I was trained through the community colleges. I had a bachelor's degree in another field, so I had the bachelor's and 4-year degree experience before I became a nurse. And what I found was there are a lot of myths associated with community college education. One of them being that somehow it is less
inferior.
That it's inferior in some way, that it's quote unquote a junior college, that it's for people that, wouldn't do well in that competitive, high yield environment. And actually the opposite is true. When we educate at the community college level, we follow a standard of education that is also the same standard that bachelor's degree programs need to address. Right. And the other beautiful thing about community college is that the costs are thousands of dollars less. The first entry level point, to become a registered nurse is the associate's degree level. We are encouraging, based on all of the evidence, that 80% of associate's degree nurses achieve their bachelor's degree by 2020. So that's
is that a requirement, or will it be?
It is a request based on the evidence that shows that as we continue to grow our education, the outcomes for patients are a lot better. So there's a lot of wonderful partnerships with community colleges and 4-year degree schools. And the bilingual program is one of those ways to go about it.
How long is this career, the nursing career? How long does it take for someone that right after high school, how long would it take for someone to become a nurse?
So after completing a certain level of prerequisites, it's about 2 years, 2 to 3 years, depending on, if they did any advanced placement in high school, if there's any kind of additional education that they might need before they move into the college level courses.
I assume that becoming a nurse is in a different field cost-wise than becoming a doctor. Am I correct? Is there any extra cost, or is it just almost like getting a degree?
Well, if we look at the levels that nurses can get to in practice, as La Doctora knows, of course, there are, I hope to get my PhD as well. And so, when I look at my debt ratio, as we continue to get degrees, the debt increases. But as far as getting into the profession, you can do that with an associate's degree. And that I think runs, and I could be wrong, but somewhere between $15,000 and $17,000, including books and supplies.
To become a nurse?
To become a nurse, to always have a job. Through an associate's degree.
Associate. Yeah. So if you want to pursue higher degrees, then it's going to be more.
Yes, it will be more, and then that moves to the bachelor's level. So the difference between the associate's per credit versus the bachelor's per credit is about a $400 difference.
This is very important because this is one of the campaign's goals, is to promote the BSN prepared nurse. And that's very important. As Marilyn said, it shows that patients do better when a nurse has a BSN, has the most education. But for a lot of minority students, especially students that are in the rural setting, you pursue an associate degree because, like she said, $15,000 compared to about $60,000 roughly is the average in this country that a bachelor's costs. So you're, making a decision of $15,000 per year, and you get educated, and trained to be a nurse versus $40,000 to $60,000 a year if you go straight into a bachelor's degree program. We want you to do that. But those are the real decisions that students make.
Now, you're saying this thousands of dollars, but I assume there is financial help. Were you able to get some financial help, Erica, and is there available?
Yeah, so actually through NAHN, I did obtain a scholarship. We give scholarships every year, and actually fall scholarships just opened. So for this year, we do have the NAHN deadline is September 30th, and then we also partnered with ALMA, who also provides scholarships to our nurses, and that deadline is November of this year.
So ALMA is a nonprofit who offers scholarships. NAHN offers scholarships, and obviously each person will have a ton of opportunities to apply online, definitely, right?
Locally and nationally.
Right, exactly. So we have our local chapter that provides scholarships, and then our national chapter that also provides scholarships. So in addition to scholarships, we also have grants. So the government, it depends again on your debt to income ratio, but they will pay up to 80% of your loan back for you
once you graduate and start working.
Correct.
Okay.
And if you're working for a critical shortage facility, you do qualify.
That's already a law in place. It's not like
it's a program.
Oh, it's
Correct.
a program. Okay.
And actually, you can probably speak more on that.
Yes, so we have both the national, like Erica said, the national scholarships, but there are several federal programs that are still available, and we need to take advantage of them while they're still available. One is the National Health Service Corps, and that's if you're a provider in a area that's underserved, the government will pay back a certain percentage, up to 85% of your loans, which is huge help.
Great help.
But David, I think this is important too, because I didn't know this when I was young, and I wish students, and I want students to know this. If you set your eyes high, like Martin says, you can go anywhere if you have the grades. Most universities, like the University of Pennsylvania, has what is called the Penn Compact, which means that any student, if you have the grades, they will pay for you to go to school. So we need to know, and we need to spread that to all of our young students coming up, because we want them to achieve, like Dr. Hernandez says, the highest they can. And not everybody knows that.
Mrs. H. from Aguila says good grades equals money.
Exactly. If you have the grades.
Add something, Marilyn?
The other thing too is a lot of hospital systems are supporting the BSN education after the associate's degree. So they will give you a certain amount of money per year so that you can get to the bachelor's degree level.
Dr. Hernandez, take us to your field with doctors in terms of cost. And just
this is going to be a beautiful story. And my wife, I love you, but I'm going to share you our stories briefly. It is an amazing story because on one side you had a brilliant, phenomenal, gifted student from a border town of San Luis. She literally had straight A's all her life. Okay. Yes. But she worked super hard. She was number one in her medical school class as a Latina. She had scholarships to Baylor, to Stanford, every school in the U.S. medical school. She was literally the perfect medical student. Why? Because she had great grades. Then you had this little kid named Martin, a little dreamer from California, who had decent grades. But yes, that's me. But the one thing that he did not have, and this is what I want the students out there to know, because anything you do, whether it's nursing, whether it's doctoring, you're going to have to learn to take standardized tests. So you need to learn to prepare, and that's what hurt me. So it takes money, guys. But so the final thing I'm going to say, she has zero amount of debt. Yes, I have a house mortgage in debt. It's over $100,000. But get this, I have 3 degrees to show. And my 3 degrees, I am so proud of. And every day I get to change lives. So you guys, you have to dig deep. What is it that you want to do? Put money aside. But learn how to be proactive in getting that free money out there. You've heard a lot of great resources today. So we wish you luck.
And students don't apply, David. We need to encourage them to apply and to do the work.
Are they having too much fun?
We'll let Erika answer this.
They're busting
nursing school is no joke. But one thing I want to touch base on is our concurrent enrollment program. So
let's give a little bit more detail about the bilingual, because you already mentioned that. I know that I asked Dr. Perez to mention about the Center for Championing Nursing.
In nursing.
in America. And now let's focus a little bit more on this bilingual program. Can you elaborate just a little bit more and then go into what you were going to say?
Yeah, no problem. So the Bilingual Nursing Fellowship Program, it's based out of South Mountain Community College. But
South Mountain Community College?
But classes are being done at Phoenix College right now.
And Gateway, too.
Oh, and Gateway.
Gateway as well.
And so the process is you apply, you submit your application, you have to submit an essay in both English and Spanish. Once you pass that process, you go in for an oral board. It's a panel board. And then all you have to prove is that you are bilingual, you are able to read, write, and speak Spanish to get the message across. So again, you don't necessarily have to be Latino, you just have to be bilingual, which is amazing.
It's important to note that too, because it's about community.
Exactly.
And anybody that speaks Spanish can read it and write it, can apply.
Exactly.
Yeah, so information sessions are going to be in January. And so if you would like to get more information about the program, then go on to South Mountain Community College website and put Bilingual Nurse Fellowship Program in the search box, or you can even go on Google and say Bilingual Nurse and Phoenix, and it will give you the website.
So what would you say is the difference between going the normal, regular, standard way of becoming a nurse as opposed to going through the bilingual program?
Being a
Huge
Latina
difference.
is about community.
Community.
It is about community. The Bilingual Nurse Program does family nights. They study together. It's like you build a community. Mentorship. And culturally, a lot of the barriers that students run into are the obligations to the family. The majority of the Bilingual Nurse Fellowship Program students are mothers and fathers. In our newest cohort, we have like 6 gentlemen in our class, which I think I'm super proud of because we address the men in healthcare piece around nursing. But it's about community, it's about support, it's about mentorship. We did a really great study over the past 2 years incorporating storytelling and it was one of those things where because of the studying, as Erika knows.
So familia once again.
It always goes back to family because they have to learn so much information. I mean, it's information overload, and as educators across the country, we know this is an issue. So how do you help them remember stories? You tell them stories. So like, if you're gonna have to remember 17 different steps, if you have an emotion and a story of a patient that goes through that, then you're more likely to remember it. So we use that in the classroom at Phoenix College.
Almost like a tactic for learning.
Yes, we use the case studies, we help them get into the psychology of the patient, and it helps them remember a lot more.
But in addition to applying to the program, there's no waiting list.
No waiting list.
So currently the normal nursing programs, it's about a 3-year waiting list.
2 to 3
So
years.
NFP.
This is a great point.
The Bilingual Nurse Fellowship Program is something to be proud of for us here in the state. 2 years ago, the Obama administration acknowledged it as a Hispanic excellence, program, meaning that it is a program that addresses what we know in the literature are the barriers to Latino nursing education. They address all those barriers. So that's the difference. Yes.
You recommend it?
Absolutely.
And is this only in Maricopa County?
It is, and like Marilyn said, their goal too, though, is you start knowing that you're going to get your bachelor's, but this is your entry into the profession.
We have to go on our last break. You're listening to AARP, Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection, and we're talking about a very important subject, Latinos in health professions. This is our last segment. It goes quick. So let's focus now on something very special that we have in Phoenix, actually, and also in Yuma. What is NAHN, and then specifically the Phoenix chapter, and then if you can also say a little bit about the Yuma chapter.
Sure. So yes, like you said, we have 2 chapters of the National Association of Hispanic Nurses. The association has about 40 to 41 chapters in the country, so not every state has one, and we truly need a chapter in every state. Phoenix was started about 26 years ago.
Oh, wow.
Our 2 founders are still here and very active
know
in the
them,
chapter.
actually,
Doctora
now that I
Esther Ruiz,
remember.
Berta Sepulveda, very active.
Berta, and who's the other one?
And Doctora Esther Ruiz, you
Right,
need to have her
Esther.
on your show.
Of
When
course.
she focuses on mental health. You know, she's a psychologist and a nurse practitioner. So they're the original founders. It started about 25, 26 years ago. And it started with a small group of nurses at meeting because they saw the need. They saw that, you know, we need support in addressing the linguistic and the cultural needs of our patients. What do we do? They all had the similar concern. And from, you know, the history of our chapter is that they, you know, started to meet regularly, recruit other nurses, and now Phoenix has over 230 members in the chapter. So it's grown, like you said, to be the largest in the country.
Can
so
it grow a little bit more?
Oh, okay. Yeah. I mean, there's
Are there many nurses that have not joined?
Well, I mean, so nationally we have a little over 2,000 nurses.
Okay.
But earlier I said there are about 168,000 Latino nurses. So absolutely, you know, we barely have not even 2% of the profession represented. And it's important to join because we represent the interests of Latino nurses.
What do they do? Do they have monthly meetings or?
Yes, monthly meetings.
events,
Erica can talk about those.
fundraisers?
Erica?
So yes, we have monthly meetings every third Thursday of the month, and actually our next monthly meeting is on the 21st at GCU from 6 to 8.
Is there a website that people can?
Yes, so we can go to www.phx- NAHN.org for all the information. We have all our scholarship opportunities on there, volunteer opportunities, about us, our mission, vision, values, all of that on there.
And now everyone wants to go to Facebook. Do you happen to have a Facebook
We
account?
do have a
Yeah.
Facebook page, and we're
Same
very
name?
active.
If you
Actual
type
name
National
is-
Association of Hispanic Nurses Phoenix,
pull
it
up.
comes up.
Right.
On Facebook
Yes,
or on Google?
Facebook and on Google. You'll
Okay.
come up with the Twitter
Perfect.
handle, the
Right.
Facebook
Google is a
page,
good
and
friend of
yes.
ours.
Yeah.
And you know, to your question, David, because this is important. Like Erica said, there's mentorship, there's scholarships, but there's also evidence that the association promotes and implements. For example, we did together with you the education around the Affordable Care Act, educating
That's
our
how
community,
we met, actually. You
educating
and I
our
had
community.
not met
Yeah.
until ACA came along.
Until I saw David.
You went to DC.
Yes.
You wanted to touch base with our state
I was
office
doing some
here
policy
in AARP,
work.
Arizona.
Yep.
And then you were supposed to talk to my
Yeah.
boss. My boss says, no, it's David Parra who you
And
need to
he
talk
was
to.
right, and he was right,
We talked,
David.
and
Yeah.
then we trained nurses. And
We
I
developed a
believe, Dr.
module,
Perez,
yes.
that you and I and the nurses in
Yeah.
AARP were the first ones,
Exactly.
or at least among the first
We
to
were.
ever teach the Affordable
Well,
Care
not
Act in
just
Arizona.
that. Yes, it deserves.
Yes.
Not just that, but with your partnership, David, we obtained funding through, as you remember,
I
the Center to
remember.
Champion Nursing and AARP, and then we obtained funding through the Office of Minority Health.
Okay, wait. Two fundings. One was local.
Yes, and national.
A few $1,000s to do outreach.
Yes.
And then you brought this model between the nurses and AARP.
Yes.
And how much did they give you
Well,
nationally?
nationally, we received about $50,000, $25,000 each year for 2 years.
For the nurses here. But the
Nurses
grant
in Yuma,
itself-
yes, the Yuma chapter and the Phoenix chapter. And in a year, we educated over 1,000 families.
Yes.
So we took that model and implemented in 10 states. And in the 10 states, we reached over 10,000 families. And it was funded by the U.S. Department of Health and Human Services. And it as an exemplar of nursing leadership.
Wait, what department again?
U.S. Department of Health and Human Services, Office of Minority Health.
That's unbelievable.
So $500,000
Our
we received.
quote-unquote little
Yes.
partnership here made it all the way to Washington.
And
huh?
I'm working actually on the publication
That
of
feels good,
results.
actually.
Very good. So that's the kind of impact that the association has. It's yes, it's scholarships, it's membership, it's having these monthly meetings, it's talking about business related issues, but it's also about making a true and measurable impact in the community. Ever since then, now we've replicated that same partnership with Planned Parenthood of Arizona, with the March of Dimes, with so many others. Erica can talk about this. And now the association is implementing a true mentorship model where students are matched with the mentor who spends time with them. We know that in any profession, mentorship is key to being successful.
Right.
So,
You know, I have a list of about 50 health professions that I brought in. Obviously, it's impossible to talk about all of them, but you have some that require more education, some that require training, some that pay more, some that pay less. kind of, my brother became, I believe they call them certified nurses assistants at some point in his life. And I was so disappointed at how little they pay. And they do so much work. I mean, he used to come home and tell us all that they do. And I said, and they only pay you $12 an hour. That's crazy, So people have to decide, where they want to go. Some careers require more effort. They pay more, etc. And obviously, we're not about to go into this list of 50 careers. But
I thank you so much for bringing it up, David, because this is an area where I think all of us can make a difference. And where even in my own association, I wish that we did more to reach out to the certified nursing assistants, medical assistants, because that's where the highest immigrant and diverse population of healthcare workforce exists. So the majority of them, it is a lower paying job, but the majority of them are diverse. So we could do more, wouldn't you say, Dr. Hernandez?
Yes, and I'll give a great example here. I'll give an example. Medical assistants. I have, in my career in medicine that started in 2004, I've had an amazing experience meeting so many Latina medical and Latino, but more Latina medical assistants. And a lot of them, I'm always pushing them to think, what's your next step? And I think that's a very important point for anybody, Latino, Latina. It's, you just got to get started. And actually, I started as a volunteer at UMC bringing food trays to the ER. And it was that one moment when they're like, does anybody speak Spanish? I rose my hand, and that's when I found out why God made me. And you guys have to put yourself out there to find that. And so get started, start anywhere medical, but always keep dreaming big. And there's so many programs out there. So again, don't let money be a factor.
I agree with you. I have to say that, you can't weather the kinds of conditions that medical workers work under unless you're driven by something that is beyond the pay. They don't pay anybody in the medical field enough as far as I'm concerned.
Would you say you kind of have to have vocation?
It is. It's about passion. It's about your story. It's about the kind of thing that's going to push you through so that you go back the next day. And that, there's a very high attrition rate in nursing school because, sometimes the story is not powerful enough to push them through. Do you see what I mean?
Yeah,
and so, a lot of times the students will run into these barriers around obligations for family. And so we, have to also educate families of people that are pursuing degrees, whether you're going to be an EMT or a pharmacy assistant. The families need to step up and they need to help their loved ones out. They need to do the dishes. Right. They need to go the grocery shopping. They need to do homework with the kids. And you can do anything as long as you have the support. And even if you don't have the support, if your passion is strong enough, you're going to do it anyway.
Yeah. Let's take a step back. We only have 3 more minutes. And what's going to take, I believe we're making progress, but would you just talk to the Latino community out there, maybe students, and just encourage them that in the 21st century, there's no way around it. Education is going to have to be the area where we have to tackle. I mean, we're good at a lot of things. I've always said Latinos are great at a lot of things, but education seems to be the area where we have to have a breakthrough.
Right. Yes. If you choose the health profession, the message is you will not go wrong because there's so much that you could do. You could be an advocate, you can be in policy, you could teach, you could do research, you could practice. The sky's the limit. So we want our community to hear, number one, that we need you, especially the Latino community. We need you. We need you to not just come in the field, but support the field. We need you to think about supporting us in ways of scholarship. The National Association of Hispanic Nurses, the Bilingual Nurse Fellowship Program. We need the help and we need the financial support, as well as, support can come in many ways. Host a meeting, invite a speaker to come and talk to your employees about health. Support us by promoting us in social media and other spaces.
Right. If you want to get motivated, come to our NAHN meeting. You will be surrounded by a group full of not only ADNs, but bachelor's prepared, master's, and doctor prepared nurses.
Dr. Martinez.
Latinos are coming. We're everywhere. Like Dr. Perez said, so guys, we need you. Come join us. We're here. We're going to have partnership, mentorship. We're going to change this country. We're going to change the world. So please come join us.
Thanks so much for joining. This was AARP Arizona Hispanic Connection. Have a great day.